Hi friends, Dr. Triya here. Welcome to another pediatric video where today we are going over the topic Williams syndrome. Williams syndrome is a rare genetic disorder that affects many parts of the body. It is characterized by distinct facial features and behavior, learning problems, cognitive delays, along with heart and blood vessel problems. In Williams syndrome, small portion of chromosome 7 is deleted, which results in numerous physical and developmental problems. Around 26 to 28 genes, which also includes elastin gene on the long arm of chromosome 7, are missing due to deletion. In most of the cases, this occurs randomly during conception. Rarely, Williams syndrome can also be inherited in autosomal dominant fashion. So when an individual with Williams syndrome has children, there is 50% chance that they will pass down this disorder to their children. Clinical features of Williams syndrome are linked to connective tissue abnormalities. This will lead to variety of facial features: broad forehead, periorbital puffiness, flat nasal bridge, short upturned nose, long philtrum, full lips, wide mouth, prominent lower lip, and small chin, that in combination give an Elfin-like appearance. This is known as a stellate iris, wheel of the cycle. Here tire, this is hub, these are the spokes, these are the stellate. In a patient of Williams syndrome, stellate iris is seen, which is a star-like pattern of iris. Another characteristic is Elfin face. Elf is a type of human-shaped supernatural being in German mythology. Elfin face is a form where the patient presents with facial characteristic bearing some similarities to those traditionally associated with elves. Other connective tissue abnormalities are narrowing of blood vessels resulting in hypertension. Similarly, when pulmonary arteries narrow, it can cause pulmonary artery stenosis, which is called supravalvular pulmonary stenosis. If aorta narrows just above the aortic wall, it results in supravalvular aortic stenosis. These both cardiac abnormality will cause cardiac murmur. And these are the distinct cardiac defects which are found in a patient of Williams syndrome. Some of the deleted genes have a role in psychological development. A particular psychological trait observed in this patient is gregarious personality, also known as a cocktail party personality, which means they are very friendly, talkative, outgoing, and have strong talking skills. On the other hand, they also have intellectual disability, anxiety, depression, obsessive compulsive disorder. They present with learning difficulties and developmental delay. Another finding which could be observed in patient of Williams syndrome is hypercalcemia, and this is due to increased absorption of calcium because of increased sensitivity to vitamin D. And due to hypercalcemia, these people also have irritability, anorexia, vomiting. Increased urinary excretion of calcium can deposit and form the renal stones. The diagnosis of Williams syndrome can be suspected by clinical features and confirmed with genetic tests such as FISH microarray analysis. Although there is no cure for Williams syndrome, treatment focus on management of congenital cardiac disease with operative intervention or antihypertensive drugs in case of hypertension, vitamin D and calcium, restricted diet to be given to reduce the level of calcium, physiotherapy, occupational therapy, speech language therapy to maximize development, social skill, speech and communication skill. You can take the screenshot of this slide. Remember the term Elfish. E, Elfin face. L, long arm of 7. F, friendly with stranger. I stands for intellectual disability. S stands for supravalvular PS or supravalvular AS, and H stands for hypercalcemia. You can find the link of notes of Williams syndrome in the description box, which can be downloaded as a PDF. If you like to have such more notes in upcoming videos, please let me know.